I was 30 years old and I was on vacation out in the Grand Canyon area, and I had gained a little bit of weight, and it was a very physical vacation, and I was having a lot of trouble catching my breath. I thought, sure, I've gained some weight and maybe that's why. And shortly after I came home from vacation, I started coughing. It turned out that I kept coughing, I got a chest x-ray, and it looked like pneumonia. I spent a week in the hospital on IV antibiotics, and my pneumonia didn't get better. At that point, they did a bronchoscopy and found that I had lung cancer. When I was first diagnosed, it was thought to be maybe stage 1, possibly stage 2, to where it would be something that was curable either through a targeted therapy pill, a chemo pill, or even a lobectomy. But that I would be someone who would have lung cancer, get rid of it, and move on with the rest of my life. It was over the next month, through additional testing, that we realized that in fact I was stage 4, non-operable, and that I would someday die of lung cancer. I'm now on a second-generation ALK inhibitor clinical trial called LDK-378. And right now it's helping a little bit, and when it stops helping, because that is bound to happen, hopefully it'll take longer than sooner. When that happens, I'll probably go to another type of clinical trial or to chemo and then back to another clinical trial. So the idea is really, at this point, is just to string as many of those together as possible to get as much quality of life as I can. I think we're at a spectacular spot. The fact that I have this genetic mutation, which 3 to 5% of non-small cell lung cancer patients have, and that there are such advanced treatments for it, speaks volumes about what has been done. Certainly, though, there are other mutations and ones that are much more common for which there are no targeted therapies yet, or they're just beginning trials with other targeted therapies. So I think while it speaks testaments to how far we've come, we certainly have a lot more work to do. I first became acquainted with LUNGevity by doing an online search through the forums, looking for someone who could tell me more about what it's like to have lung cancer when I was originally diagnosed. I also go to LUNGevity to look for things that are less pleasant, that people don't like to talk about, like what's it like in your last few months of being a lung cancer patient. There are a lot of difficult things that's even hard to speak of person to person. And once you are behind a computer, you have a sense of anonymity that protects you and lets you ask these questions. For someone who is recently diagnosed, I would just say that, to keep an open mind, to understand that this isn't the end of the road. This is just a really, sharp turn.